Hello everyone, welcome to the Varicose. Today we are going to discuss an topic CEAP classification. This is an important topic. If you are in second year, suddenly going to the surgery posting after varicose veins discussion, they will ask you a question. What is the CEAP classification? CEAP in CEAP, C is clinical, E is etiological, A is anatomical, P is pathophysiology. Okay, first we will discuss about the clinical classification. C0 is no signs of venous disease. No signs of venous disease. C1 includes two things: telangiectasia and reticular veins. Either it may be telangiectasia or reticular veins comes under C1. C2 is varicose veins. C3 is edema of the limb. C4 is skin changes. The skin changes include C4A, C4B and C4C. C4A is eczema or pigmentation. C4B includes lipodermatosclerosis and atropia blanche. And C4C includes corona phlebectasia. C5 includes healed venous ulcer. C6 is active venous ulcer. And the new one included in this classification is C6R. C6R is recurrent ulcers. Okay, we will see images and we will recap everything. C0 is no signs of venous ulcer. C1 is telangiectasia or reticular veins. This is telangiectasia and this is reticular veins. If you want to know about the reticular veins definition, see the previous video. Next is C2 is varicose veins. You can see the dilated tortuous veins on the lower limb. And next C3 is edema. C4 includes skin changes. And C4A is eczema or pigmentation. We will see the pigmentation on the limb here. And this is inverted champagne bottle sign. This is important for MCQ. What it is? This is lipodermatosclerosis. And this comes under C4B. Next is atropia blanche. This is atropia blanche seen in C4B classification. And C4C is corona phlebectasia. If you want to know about the corona phlebectasia, see the previous video. I detailedly explained about the corona phlebectasia. Next C5 is healed venous ulcer. We will see ulcer and active venous ulcer and recurrent ulcers. That is complete about clinical. Next comes the etiological. EC is what is the etiology is cause. So it may be congenital varicose veins, that comes under EC. EP is primary varicose veins due to the venous problem. Secondary varicose veins due to secondary causes. And EN is no venous disease. Next, anatomical. We'll see AS. So anatomy means here it is venous system is involved. So in venous system of the lower limb, what are the things we will see? Either it is a superficial venous problem or deep venous problem or perforators. So it may be superficial superficial anatomy includes superficial deep veins problem or perforator problem. So AS is superficial vein involved, AD is deep veins involved, AP is perforators involved. Next, pathophysiology. Pathophysiology, either it may be obstructive or reflex. Obstructive example, can you give me an example? Yes, you are correct, it's DPT. Okay. Reflex, it is perforator valves issue, valvular incompetence causing the reflex, and it can be both. A person can have DVT with valvular dysfunction also. Okay, this is whole summary about the whole thing about the CEAP classification. So how I remember this C classification? First, C. Initially anything will start with a small things. So telangiectasia and reticular veins are, reticular vein is 1 to 3 mm in size. So then the size increased. Then the size increased to varicose veins. So varicose veins is C2. Varicose C2 is, it is 3 mm, more than 3 mm. So if it is varicose veins, so varicose veins is dilated veins. So it can cause edema as per your physiology. So because it is in hypertension means hydrostatic pressure will increase. More blood is there, hydrostatic pressure will increase and it causes edema. Then after, if edema is there is a stretching of the skin will be there. So skin changes will be seen. And after skin changes, like there is a continuous stretching, the skin changes happen. So next, blood supply to the skin may be decreased. So that can cause ischemia and further ulcer. So that initially it can be cured, healed venous ulcer. Then in the later stages it can be complete active venous ulcer and chances of recurrent ulcers. This is how I remember the clinical classification. Remaining all are EA anatomy, that is logical. Okay, that's all. Thank you. If you like it, subscribe. Thank you.